welcome back from the break. Chandra, when we spoke last, we talked, you gave us some insight into how the healthcare infrastructure in India works from a local rural clinic to then referral to a regional center and then having larger tertiary care referral centers in the city. India is doing a lot right now to build a universal healthcare infrastructure, including an EMR and a digital healthcare infrastructure. What can you tell us about that, and how is that impacting what you're trying to do to build more equitable access in rural communities?
Great, thank you for that question. So, what India is building right now is, their flagship product called Ayushman Bharat Digital Mission. So through which they are trying to digitize all the medical records. As we know, right, most of the urban population also they don't carry most of their medical records. So what the government of India is planning to do is ensure that each and every individual in the country has access to their medical records on a regular basis. So, part of the digitization initiative, what they've done is they started creating these health IDs. We call them unique health IDs for each individual in the country with a unique number. And so these health IDs will ideally carry our medical records in the form of digital. So all the digital records are always there with in that link to that ID. And for even if you lose physical records, your digital records are always there stored in secured servers. So part of that process, the way they are building it is they have created three different layers. One is creation of the health ID. So we as a partner, they have given us links, I would say APIs and other interface access to their interface to link our platform to their systems. So any patient who comes to our clinic, so we can actually generate their health ID with that linkage with the government, and post that we can also link records. So after the consultation is done, whatever the records like prescriptions and maybe diagnostic reports, whatever we generate, we can actually link them to that health ID. And then there is a level 3, which will basically enable others to retrieve whatever I have linked at my center. So that is the kind of interoperability they have built, wherein uh, the player who wants to, or I would say the service provider who wants to have access to these records, they don't have to reach out to me or take permission from me, right? So they can actually retrieve the records by just punching in that health ID number which I created initially, which is basically a unique number once it is created. So the the service provider at a later stage, if they want to retrieve that record, they can retrieve those records with the consent of the patient. So they can take permission from the patient, and if patient is willing to provide access to those records, all they have to do is just punch in that number and they get access to all their medical records. So government has just started building building in infrastructure. It's over 2 years now. They started slowly linking the records of each and every rural patient to those records, to those IDs. And the major, I would say, the objective of this is to ensure that they have access to the medical records whenever they are enabling insurances to the communities. So, typically what happened in the previous years is a lot of these insurances were misused because I think without not having valid records and the patient history, so a lot of these insurance claims were actually proven to be wrong, right? And the insurance company or the sector did not have any valid documents to verify whether this person had this illness or not. So there was no history, and all the records were created very newly. So that has become really a problem. And unfortunately, as you know, people do misuse the system whenever there is a possibility. So this will definitely ensure that before somebody claims an insurance, they have looked at their past history with this health record, which is unique. Nobody can go and change or tamper those records, and the sources are coming from different locations, right? So it is not just one source. So I, as a partner of the NHA, I would say, National Health Authority, I can enable those services. Another provider who's also working along with the government on this initiative, so he or she, they can also add their records. So as the patient journey goes on, they go to different, say, clinics or hospitals. Wherever they go, everywhere they are going to link those records to their unique ID, and at a certain point, when somebody wants to retrieve them, they can get access to all their records, previous histories and everything. So that makes it very easy for the insurer as well to enable or offer those services. It also limits the misuse of the system. So and overall, I think everybody can work better with this model. And even if you lose the records, it's not a problem end of the day. So that is what the government of India is trying to build, and it has come a long way already. And slowly, a lot of they are focused mainly the rural communities to start with, but now they are trying to even push it to the urban communities as well.
With such a system, with a unique medical ID and records from many different service providers being linked to that ID, there has to be a central database maintained by the government in order to have those records in one location to be retrievable by everyone. Is that correct?
No, exactly, because what they have done is the way the technology, the framework they have built is that uh, it will actually retrieve the data from our servers itself, right? So that's how the linkage is done. So it doesn't need to kind of bring all the documents at one place, because that is going to be very heavy and huge infrastructure requirement and cost, right? So ideally what is happening is whenever somebody is trying to retrieve, so wherever these health IDs are linked, so it is going to make a request from all those respective locations. I mean, it is digitally done, and then it will retrieve the records in their wherever this service provider is trying to access. So basically, from my server also it goes from different somebody else server. So as long as those records are linked, so it will not retrieve everything, and it's all like token based. So only those records which are linked to that particular ID are retrievable, and so that is how it works. So there is no central repository, to answer your question.
Excellent. And can the patients do the same thing as the healthcare providers can and access all of their records for themselves?
Yeah, so they have access to their complete health records, and also for linking and also for retrieving, there is consent mechanism where they even when they are talking to different providers, like one of the provider is trying to retrieve the health record from the different provider. So again, they have to take the consent of the patient. Sometimes they also need to take the consent of the doctor, and even patients can actually limit the time they can enable access to the provider. So if they want to define a time, right? Okay, you can access my records from say for this particular month or even specific days. I can define that, and suddenly after so as a patient they have complete control, right? So let's assume an example. I go to a hospital, I give them my ID, and I let them access my records. And then after some time, maybe I feel like I don't want to get my treatment done here, and I decide to leave. So I can actually revoke the access. I can even basically cancel that accessibility to my records. So the complete control is in the hands of patients. So they can revoke the access, they can enable the access, they can also time limit till when they want the records to be accessible to the third party, right? So all that is done and can be done by the patient.
That's excellent. And how long does it take for this integration to happen at the point of care? If a patient comes in with a health ID to your clinic and you register them with that health ID, how long will it take for your clinician to be able to gather their past history?
So as I said, the health ID is always created once. So whether I generate or they do generate self, so they can even self generate or self registration is also possible, right? So the patient can also create their own health ID by accessing the government portal, or if a patient is coming to me from to my clinic, I can also do that. But if a patient is already has come and he's got a valid ID with him, all I need is just punch in that health ID number in my app, in my interface, and then request for the documents. And as I said, when I make a request, there is an OTP goes to the patient. So the authentication happens through the OTP mechanism, right? So when I'm trying to, like, I take your ID, I put in the ID and I request for the records, and the OTP goes to the patient. And if once the patient approves, then only I'll be able to retrieve that record. So it's matter of few minutes, but yeah, the accessibility is quick and fast. And only once it is authenticated by the patient there, I get to see the records.
Excellent. That is definitely an innovation for the future for all patients. Can I ask, are there any results, data, or KPIs that you are tracking and trending from your work in these rural clinics thus far?
So right now we are trying to see, we are trying to measure how many specialist consultations are we doing on a regular basis. So we really want to build that. I mean, we want to really make these digital clinics enabling advanced care from those centers, right? So even though right now the footfall for primary consultations are quite good, the specialist consultations obviously are slowly picking up. So we are trying to measure those, and because we feel there's a lot more attention to be given to specialist consultations, and there's an opportunity there. So we are measuring those specific aspects of it. Other than that, the other as a company, we want to make this model a successful model, and we are attempting that with our sustainable models as well. So we are constantly measuring, looking at our business models, revenue models, constantly revising them on a regular basis. And we're also learning from the ground on what the response is, how people are reacting. So yeah, so I think several factors of it are something we are regularly tracking and measuring.
With that, I'd like to ask what opportunities are next in this telehealth specialty consultation space. Where are you and your company looking to grow? And is there anything that you would like to ask from the global community?
So what we see as an opportunity is, I think, recently we have attended some summits, and lot of other startups who are building very unique and any I would say advanced technologies. Like there is a ECG machine which is of a mobile size, right? So that has been built. So I think our model will really help all those innovations to become live, because we can actually become a platform for them, right? And we have actually spoken to one of the, I would say, accelerator in it's called India Health Fund. So they are looking to enable other startups who are working on very specific devices or products. So, for example, an ECG, which is a very small pocket size, and that can actually become as part of a model for doing ECGs at our center itself, right? And there is another startup which is building diagnostics in the form of paper, right? Right. So I think with a very less investment, so it's like uh, they dip it in a particular solution and you get results instantly. So I'm not able to articulate what exactly the product is, but it's very, I would say, frugal solution compared to our typical models. So there are such very, I would say, unique and advanced solutions are there, and which have proven, they have proven their metal in the market already. And so we look to collaborate with such institutions and then kind of enable probably at least 90% of the care from the same center. So imagine a small rural clinic can enable all the diagnostics possible, all the specialist consultations possible. And if everything goes well, we will also set up a small few beds, so maybe we can take care of the advanced surgeries and other things in the future. So I think our our model, what we are building right now, it can also give us a lot of leads, right? Eventually, instead of reaching out to big hospitals, we could probably build our own set of hospitals which can enable these surgeries at a very subsidized cost again, right? Because end of the day, they are paying huge money when they go to the hospitals. So there are such startups as well which have become very successful, with a very limited infrastructure. So I think the hospital at home reality is going to come very soon, right? Where you don't have to go anywhere, so your home can become a hospital.
A hospital and your job and many things else, sir. We will all be just sitting at home. That's excellent. Thank you for that. Is there anything you would want to ask from the community of listeners? Anything that would help you and the community of innovators make progress on global equity? This is your chance to make a wish.
Yeah. Now, I really want to kind of showcase our sustainable models, because what I learned from many impact investors is they really want to look at and invest in solutions which have future, which can sustain on themselves. So I think we build such a solution, and we look forward to connecting to such impact investors who are willing to collaborate, or I would say support in this endeavor. So that's going to be my ask, and look forward to great partnerships and collaborations across the globe.
How can our audience connect with you?
They can reach out to me at my email. It's Chandramouli, ChandramouliAtcare.in, care.in. Or they can go to our website as well, which is much easier, caare.in.
Thank you so much. It has been my absolute pleasure to continue this conversation with you. I can't wait to see all the places you grow and all the wonderful things you do to increase access to primary and specialty care for people not only in India, but the Philippines and all over the globe.
Thank you so much. I really appreciate this opportunity, and I think this is a great platform to share our vision, and they also gather support. I think this is like a wonderful opportunity for us, and thank you for doing this. And this is a great initiative from your end as well. Thank you.
We have heard from many of our guests about the importance of public, private, and government collaboration in healthcare equity efforts. So I will ask our audience, if you are a minister of health or other public official working to increase healthcare access and equity, we want to hear from you. We want to add your voice and perspective to this conversation. Please join us and be a guest on our podcast. Email us at info at haew.org. If you enjoyed our episode today, please share it with a friend who you think would also enjoy the topic and conversation. Leave us a review, give us your ideas and feedback. And if you'd like to learn more, join us, partner, or donate, please go to https://haew.org. Chandramouli Samathan, thank you for a wonderful conversation today and for the great work you're doing.